Some reaction to President Cyril Ramaphosa's address last night. SA Medical Research Council CEO Dr. Glenda joins us now from Cape Town. Very good morning to you. What should we be preparing for as we move now into level 1? What sort of impact is this likely to have on the virus?
So I think the most important thing is to maintain our non-pharmaceutical intervention implementation. So the most important thing is to make sure that you continue to wear your masks over your mouth and your nose. You continue to wash hands and have physical distancing. Very important to avoid crowds and congestion and make sure you're always in a well-ventilated room. We do expect infections to continue until we have a vaccine. This virus will be with us for a long time. So we heard our president say we have to learn to live with this virus. And the only way we can learn to live with this virus is to make sure that we protect ourselves and our community.
Many countries that relaxed their lockdown regulations internationally were hit by a second wave. So what can we learn from them that we can adopt here? Because it surprised everybody that we haven't been as hard hit as we could have.
We need to continue to watch what we do. A lot of countries did not implement masks, public masks. They didn't implement social distancing and crowd control. And so I think we have some advantages over them. However, I do think we will see an increase in transmission rates. And I think at this moment in time, our hospitals know how to cope. We have enough beds. And so although we may see an increase in transmission, we must make sure it never, ever gets out of control to the point where our hospitals are overwhelmed.
Yeah, I mean, that was our biggest concern, wasn't it, that we would be overwhelmed? Tell us more about what we have learnt about treating patients and how the system should work as we continue to finesse the missing bits.
So I think what we've learnt in South Africa is what comorbidities affect our outcome of our patients who get admitted. Certainly older age, over than 55, being obese, hypertensive and diabetic. And if you're out of control, these things will make you have an adverse outcome. We also have realized that if you have got COVID-19 and you are sick, it's very important to monitor yourself at home. One of the biggest things that caused deaths was not realizing how deoxygenated one had become. And so home monitoring of your oxygen saturations is very important. Getting to hospital early to be assessed. In hospital, the use of oxygen early on, using dexamethasone, a steroid, and nursing people in a prone position and improving our ventilation methods definitely helped outcome. We did see an improvement in the management of patients in ICU over time as doctors became more proficient in managing the COVID-19 in ICU.
And what sort of things can we no longer have to worry about? I mean, I think it's been pretty much proved that we don't ever have to have a tobacco ban again. I mean, there's speculation now that it's not transmitted as we thought, possibly on surfaces. What have we learned about the virus that we can dismiss and that we need to embrace?
Well, we've learned that this virus is airborne and we need to make sure that there's lots of ventilation and that there's not crowds. So we learned how transmissible this virus is in close containment and when you're close to people. And so the most important thing for me about learning about this virus is about the need for physical distancing and making sure that there's good ventilation. And that's very important. It's important how we learned how important masks were, and particularly covering your nose, because if you're breathing out the virus, you can spread it, particularly if you're in a congested area. So those are the things that we've learned. We've learned how to manage the virus better in the hospital, and we've learned how devastating it can be if you don't realize how sick you are before you get to hospital. We've also realized our bed capacity and also realized that how to manage bed capacity in times of surges.
And going forward now, what should we be doing as a country, until we get the virus? And what sort of timeline are we looking at when it comes to, not getting the virus, getting a cure?
Getting the vaccine. So what we have to do as South Africans is to protect our vulnerable. And so we know a large portion of our South Africans will be asymptomatic, the young, the people who don't have comorbidities. And it's our job as young, healthy South Africans to protect our old and vulnerable and those who could die from COVID-19. And so for some people, for most people, this is a mild asymptomatic infection. But for others, it's devastating and can cause death. And so what our job is to do is to protect those who could die from this disease and make sure that we don't transmit this virus to people who could die. And for my message is to continue to respect the space between people, continue to wash your hands and continue to wear your mask, because this is helping us slow down the epidemic and helping us buy time until we have a vaccine.
Always good to talk to you, Glenda Gray.